It's a beautiful, beautiful setting being here at Dawson College, and I'd like to thank Joe for doing such a great job in organizing this symposium. And it's been wonderful this weekend, meeting so many different people. I've been able to network. I've met various mental health professionals in the field. I've met many parents who have told me or shared some of their very tragic stories of being alienated. Some of you have been able to reconcile with one or more of your children, and others haven't. It was very sad to learn that Dr. Bone is ill and wasn't able to make it here. And when Joe called me at my office, I practice in Penticton, British Columbia, and Joe called me. It was late afternoon on the Tuesday, and he said, actually it was an email, and it said something about time sensitive, call me right away. So I called, and he told me about Dr. Bone and asked me if there was any chance I might be able to fill in. I have to admit I was a little stunned when I received the call, and I probably was quite speechless, and I said, hey, I got to get back to you because I had a patient waiting. And I thought about it, and I thought, wow, these are awfully big boots that I'm going to have to fill. However, I'm up for the challenge, so it's a really good pleasure to be here. Now, this is not meant to sound like an excuse or a justification by any means, but typically speaking, I am extremely prepared for doing these kinds of seminars or workshops, and I really like to speak from my heart and not use any notes at all. However, given the very short time that I've had to prepare for this, I will be using my notes this time. So bear with me that way. All right, I'm going to start off by showing you a cartoon that I found that I thought was great to depict what PAS is not. Can you see it okay? Can you see what the X-ray is? Okay. Nobody's laughing. That's not a good sign. Okay. Yeah. I'm just going to go over what the objectives are during this very brief presentation. I'm going to talk to you about some special considerations for those of you who provide mental health counseling, for working in particular with alienated parents. I'm also going to go over why it's so important to incorporate a CBT approach when working with alienated parents. Hopefully during this presentation you will acquire a greater understanding and have a greater amount of, I'm not saying that we don't have empathy, but what I'm saying is a greater amount of empathy, and to be able to validate what it is in terms of the emotional roller coaster ride that alienated parents experience. As well, I'm hoping that in this presentation that you will have an opportunity to acquire greater knowledge and understanding of why it's important to help alienated parents learn effective ways to overcome negative thoughts, feelings, and behaviors that can stand in the way of not being able to rebuild a loving relationship with their children. And as well, for those of you in the audience, which I see are a fair amount here still of alienated parents whom I've spoken to, I'm going to offer some very brief strategies on ways that you can deal with some of the counterproductive thinking that tends to get into the way, and helping you in recognizing that it really truly is a productive thought that counts. So with that said, when I was a little girl, my mother often said, don't just stand there, do something. And so I did. And I hope you will consider my dear mother's advice too, because this saying holds a lot of truth and meaning when PAS has been identified. One of the most important things to keep in mind is that the seeds of parental alienation syndrome can sprout quickly. Mild PAS in a child or youth can quickly progress into moderate and severe levels. And the greater the level of severity, the harder it is to reverse. And so I encourage all of you who are either just in the beginning stages of this, that really do your very best to take swift action to help stop this progression. For those of you who haven't, or for whatever reasons have taken place, this isn't meant for you to feel like a bad person or a bad parent or anything like that, but rather it's about knowing that there's still a chance. We never know what the future holds for any of us. And in saying this, you are encouraged not to do this alone. Rather, please consider seeking professional assistance. Now, through the years, many alienated parents that I've seen in clinical practice have claimed the opposite. That is, they've believed or had been advised by their friends, their workmates, or family members to not do anything, just let things happen naturally. And many of these same parents were also under the impression that their alienated child or children would someday grow up and snap out of it. And unfortunately, for the most part, nothing can be further from the truth. Just as early detection of cancer can save lives, early detection of PAS can save families. Now, very often a third party, such as a judge or attorney or alienated parents themselves, requests the services of a mental health professional for individual and or family counseling. When this occurs, the targeted parents may have some contact with their children, while others may not. Some self-referred alienated parents may be able to bring their children in for therapy. However, most are not able to. In the latter situations, the children not only refuse to attend family therapy, but their alienating parents dissuade and discourage them from taking part in it. Still, those alienated parents who do maintain some form of contact with their children often endure a lot of hostility, rejection, and other negative behaviors from their children before, during, or after the therapy sessions. And in some instances, alienated parents may have been awarded restored visiting rights by the courts after a brief, medium, or long absence from seeing their children. Sometimes this works, and sometimes it doesn't. There are numerous other hurdles and obstacles that can also get in the way for alienated parents in an attempt to rebuild their relationship with their children. All in all, not only are the varying dynamics involved very challenging and difficult for the alienated parent, but it's often very challenging and difficult for the clinician to work with. Mental health professionals who choose to work with this particular population, as mentioned previously by some of my colleagues, require specialized training, clinical supervision, or clinical consultation, and lots of experience. And from an ethical perspective, competency in being able to work with this particular population is pertinent. Otherwise, the particular members of an alienated family that you can work with may be, or may potentially, endure some type of harm, even though that was never your intention. Sadly but true, some therapists have made errors that resulted in the perpetuation of the alienation, or even inadvertently created the total loss and demise of a child's relationship with the rejected parent. Clearly, all clinicians have an ethical duty to protect children from harm. Nonetheless, when therapists have a lack of knowledge and understanding of parental alienation syndrome, or lack the experience in identifying and recognizing the level of severity of PAS, the alienated child could undergo more harm than good for a lifetime. With severe PAS, obsessive alienators are entrenched in their own delusional and irrational belief system, and will not listen to reason from anyone, including mental health professionals. In these cases, the alienated children need, for the most part, in most cases, to be removed from the alienating parent's care through legal intervention. And if you currently lack the required knowledge and understanding of PAS or are inexperienced with PAS, please don't ever feel reluctant to make a referral. Don't ever feel afraid or ashamed to do so in making a referral to another clinician who is very well experienced and well qualified with these specialized cases. It is definitely not worth taking the risk not to refer if you feel you are not properly qualified to help a member of an alienated family. Clinicians who work with this particular population must be willing and able to muster a lot of extra patience, understanding, empathy, devotion, and other important clinical strengths and means. In doing this type of work, you must also be willing and available, of course, to write reports, I'm going to say out the yin-yang, as well as attend court when subpoenaed. You also, of course, need to keep abreast of up-to-date research findings and legal issues that are pertaining to parental alienation syndrome. And when working with this particular population, as mentioned previously, compassion fatigue among therapists is not uncommon. So the practice of personal and professional boundary setting, as well as self-care, is essential to help avoid clinician burnout. Now, in true cases of PAS, one of the most important things to keep in mind when working with alienated parents is that what they are experiencing is real and must not be discounted by any means. So, of course, being non-judgmental at all times is paramount. And validation and strengthening of the alienated parent's worth as a parent is extremely essential. So utilizing a strength-based focus is very helpful. And generally speaking, most alienated parents' goals for individual therapy involve learning skills to help manage hurt, anxiety, fear, panic, depression, grief, loss, anger, stress, and shame. In some instances, you will find that they are also reaching out for other types of help, such as overcoming addictive behaviors. You may also come across some rejected parents who are suicidal and need immediate interventions. Anytime you know that there is suspicion or from doing your assessment that depression is involved, it is so essential to do ongoing suicide assessments because unfortunately, but true, there are reported cases in the literature of alienated parents who have threatened, attempted, and committed suicide. Depending on the situation, some alienated parents may need effective parent-child communication skills and other types of parenting skills to help boost their confidence and offset any suspected or disclosed area of risk which may prevent the parent-child relationship from being reestablished. Many rejected parents that I've had the pleasure of working with are eager to learn about various aspects of child or youth development. And given they're working hard towards having a meaningful relationship with their children and clearly wanting to do what's in their children's best interests, they appreciate receiving insights into children's needs. In certain situations, alienated parents may also require effective skills for working towards a reasonable relationship with the other parent. Of course, that being if the other parent is also willing to engage in the same. Now, many alienated parents that I have worked with require trauma therapy to help soothe the pain and anguish associated with being alienated. Professionally, I found that traditional forms of trauma therapy, CBT, solution-focused interventions, emotion-focused, somatic, and EMDR are very, very helpful for rejected parents who have been significantly traumatized. Many targeted parents also require psychoeducational guidance with respect to the nature of the court system. For example, alienated parents commonly complain, feel extremely exasperated, frustrated, anxious, and confused over the length of time it takes to go to court to get visiting and custody rights. It's not uncommon for courts to adjourn, which also causes frustration and annoyance for targeted parents. As I'm sure many of you are aware, some alienating parents fire lawyers over and over again, or lawyers fire them, creating more complexities, including prolonging the process. The entire adversarial system in family courts can be an extremely overwhelming tribulation for alienated parents. Now, some of you who are mental health professionals in the audience may actually wonder why I choose to emphasize a cognitive behavioral therapy approach rather than other therapeutic modalities. Perhaps it may make more sense to you that this should be offered to alienating parents and alienated children rather than to rejected parents. Well, the answer is cognitive theory and research has shown that cognitive distortions in patients contribute to a number of psychological and behavioral disorders. Back in the mid-70s, Aaron Beck found a positive correlation between cognitive distortions and pathology associated with psychological and behavioral factors. His theory serves as a significant basis of cognitive therapy, given emotion and behavior are immensely influenced by cognition. Beck also acknowledged important similarities between behavioral therapy and cognitive therapy, and the fact that both therapies act directly on the symptoms that cause distress. Not only is there widespread recognition that distorted or maladaptive cognitions play a prominent role in the etiology of psychological distress, but there's also widespread recognition that distorted or maladaptive cognitions play a prominent role in the perpetuation of psychological distress. Moreover, the value of shifting cognitive distortions is reinforced by empirical reports suggesting that the influence of negative life events on subjective feelings is much more powerful than that of positive life events. The reformulation of the learned helplessness model of depression suggests that the tendency towards internal, stable, and global explanations for negative events increases the risk of depression. CBT has been extensively used for treating depression and other mood disorders, anxiety disorders such as panic disorder with or without agoraphobia, social phobia, post-traumatic stress, obsessive-compulsive behavior, disordered eating or eating disorders, addictive disorders, certain chronic illnesses, personality disorders, and some forms of psychoses. Now, as previously mentioned, many alienated parents that you will see in clinical settings experience one or more types of psychological distress, such as grief, helplessness, hopelessness, depression, acute or chronic stress, anxiety, fear, worry, panic, low tolerance for frustrating and difficult situations, anger, post-traumatic stress, and addiction, among other types. Thus, the overwhelming body of literature reviews on the efficacy of CBT as a therapeutic approach for treating various types of psychological distress, including relationship difficulties, lend support for treating not only alienated parents, but alienating parents and alienated children. And one of the beauties of utilizing the CBT approach is that the synthesis of cognitive and behavioral techniques forms a package that can be tailored to the needs of an alienated family. As an example, interventions for alienated parents diagnosed with mood disorders, anxiety disorders, addictive disorders, and/or medical illnesses need to emphasize coping skills, problem-solving strategies, and cognitive restructuring. Obviously, a mental health professional will utilize a repertoire of skills and strategies to fit specific client needs. With alienated parents, it is especially important to promote a sense of empowerment to help offset pain and anguish they experience. Self-efficacy theory is based on the recognition that human beings have an intrinsic need to feel competent in order to attain their desired goals. Various behavioral techniques offered to the client can help promote the development of self-efficacy. It's beneficial to use CBT to help rejected parents identify and challenge various types of counterproductive thinking. And I'm going to go over some of the most common types in just a few moments. As well, multifaceted CBT interventions that draw on a variety of strategies and techniques to alter distorted cognitions and facilitate certain types of behavioral change can be beneficial. As part of the therapeutic process, the alienated parent learns to recognize, monitor, and record counterproductive thinking in a journal, or can be used in more structured formats such as a daily thought record. Journal keeping, self-monitoring, completing homework assignments, and providing the therapist with feedback are all very useful strategies. And throughout the CBT journey, the alienated client is likely able to shift his or her information processing from what is considered a maladaptive to a more adaptive level. In doing so, the client's self-concept, self-esteem, and overall sense of functioning can greatly improve. And all in all, CBT is very, very complementary to use with other therapeutic approaches such as humanistic, existential, psychodynamic, interpersonal, solution-focused, and as I previously mentioned, EMDR. Now, in a few moments, I am going to flash in front of you lists of well over 4,000 types of emotions that alienated parents have described to me throughout the years. Now, although the lists that follow are quite extensive, please keep in mind that there are numerous other feelings that an alienated parent may undergo that are likely not listed here. I can't stress how important it is to become acquainted with the types of emotions that I've listed if you are an alienated parent. Unfortunately but true, as many of you know already, you will experience an incredible emotional roller coaster ride for an undetermined period of time, depending on numerous factors. There will be no such thing as a flat line. In other words, you will undoubtedly and expectedly experience a wide array of emotions, hourly, daily, weekly, monthly, or perhaps even for years to come. As a matter of fact, don't be surprised to find out that there may be a great deal of the English language that's in your vernacular. Whatever you do, I encourage you, please try not to dismiss, deny, or repress your feelings. Do not postpone your emotional pain. Give yourself permission to feel what you feel in this moment. It's okay to feel what you feel. Process it. It's not okay to hide your feelings to yourself. It's not fair to yourself. And try not to hide your feelings to others either. It will not go away even if you attempt to repress it. And it's not healthy for you. In actuality, delayed pain will become more painful for you. The honest truth is that you must deal with it now, or it will create further problems for you, including, but not limited to, the following possibilities: depression, suicidal thoughts or attempts, anxiety, paranoia, fear, guilt, anger, possibly mood-altering behaviors, addictive behaviors, which may include overworking, problem gambling, compulsive shopping, compulsive overspending, smoking, disordered eating, relationship codependency, and/or sexual addictions, or perhaps mind-altering addictive behaviors, including alcohol and drug use, abuse, and dependence. These self-destructive problems may deaden the pain temporarily, but it really must be expressed and felt constructively. You don't need to suffer alone. None of us can pretend we are Superman or Superwoman for very long. Therefore, I please urge you to make a diligent effort to feel the pain, express it, share it, and eventually grow from it. Your growth will take place because you have experienced the pain, rather than giving in to the urge to delay processing it. Keep in mind that resolving your pain will eventually lead to the ability to move on with your life, no matter what happens. Even though your emotional pain will never be entirely forgotten, it will, over time, eventually decrease, and for some of you, perhaps even cease. At any time, you can decide to move out of the cycle of destruction due to the ramifications of PAS and move into the process of recovery from it. Now, for those of you in the audience here who happen to be a family member, a friend, or a professional, and you know an alienated parent and want to support him or her, then it's also very important that you become acquainted with the numerous types of emotions experienced during the alienation process. In doing so, you will have a wonderful gift that you can give to them. You will have the ability to communicate to them what you imagine they are feeling. Active listening skills, thought empathy, and feelings empathy go such a long way. And the alienated individual will likely feel validated and supported by you. Okay, so here we go. I need to show you these lists very quickly, and I don't expect, and I hope you'll understand, that because there's so many that I'm about to show you, you're not going to get a chance to read through all of the lists. But what I'm going to do is I'm first going to show you typical anxiety-related emotions that alienated parents have described to me over the years. Next, what I'm going to do is show you the list that I've put together of the types of typical emotions, what I like to refer to as mood-related emotions that have been described to me throughout the years by alienated parents. Now, as I'm sure all of you are well aware, that anger is inevitable with mild, moderate, or severe cases of PAS. Quite frankly, I have never, ever met an alienated parent, alienated child, or alienating parent escape the feelings of anger. I'm going to very quickly show you the last and final list containing typical anger-related emotions of an alienated parent. So now that we explored the numerous types of feelings that alienated parents generally experience, it's time to explore the types of negative thinking that occurs alongside various negative feelings. Now notice that the term being used here is called counterproductive thinking, which ultimately creates a lose-lose situation. I thought I'd show you this one too, because it kind of reminds me of my oldest daughter's cat, thinking that he's a big lion. And then this picture kind of reminds me of being at home. I have 2 dogs and a cat, and our cat definitely rules within the family. So I thought that was a great way of showing distorted thinking that all of us tend to experience from time to time, some more so than others. When you get caught up in any emotion, it appears as if someone or something is making you feel that way. The person or event, in other words, deliberately is causing your emotional pain. However, none of that is true. You see, what really occurs is a triggering effect. Something unpleasant happens. Your buttons are pushed by external triggers, such as your ex-spouse phoning you when least expected and provides news that you're not prepared for. Or your buttons are pushed by internal triggers, such as fatigue, lack of energy, hunger, dehydration, sickness, and so forth. Next come your thoughts. You evaluate and you think to yourself, what a jerk, this is crap, how awful, it's unfair, I don't deserve this, he or she will pay for it. Then your feelings arise. You may feel hurt, rejected, betrayed, attacked, ridiculed, mad, scared, and so forth. Your behavior comes next in sequence. You act out your feelings by running, fighting, attacking, crying, seeking revenge, withdrawing, avoiding, etc. And lastly, there are consequences. Negative thoughts, feelings, and behaviors will produce negative consequences, whereas positive thoughts, feelings, and behaviors can produce positive consequences. Truly, it's impossible for negative thoughts, feelings, and behaviors to produce positive consequences, just as it's impossible for positive thoughts, feelings, and behaviors to produce negative consequences. I'm going to show you a couple examples here. And I apologize, these are not good slides for you to see, but I'm going to read both of them out to you. One is from a fellow, his name is Jamie. Of course, all names and identifying background information have been changed. But Jamie wrote in under his triggers, "My kids arrive late for their scheduled visit with me." What's he thinking? My ex is such a bitch for purposefully making them late. I know she'll do it again. What's he feeling? He wrote down frustrated and mad. What does he do? Well, in front of the kids, he says, I phone my ex right away and I give her hell for making them late. What are the consequences? He says, my kids yell and scream at me for phoning her because it wasn't her fault. There was actually a traffic accident. Here's Myra's example. She wrote down that her triggers are, my 7-year-old son said that I don't belong to him and he never wants to see me again. What does she think? Her automatic thoughts are, how dare you say that to me? I gave you birth, for God's sakes. I bet you anything my ex has put him up to this again. What is she feeling? Upset, distraught, rejected, pushed away, mad, and furious. What does she do? Well, she decided by writing this down, I scream and I get very angry at my son. I defend myself by saying, how could you say that to me? And what are the consequences? Well, Myra said, what I ended up saying and doing actually reinforced my child's thoughts and feelings towards me. So as you can probably see, your thoughts play such a fundamental role in generating certain feelings and escalating them. And the combination of your thoughts and feelings cause you to choose unconsciously, consciously, or unknowingly to engage in certain behaviors or actions, and ultimately unwanted consequences will occur. So it's helpful to learn about the types of counterproductive thinking categories that typically occur in PAS cases. And based on terms that were derived by some cognitive therapy experts such as Beck and Burns and Weshar and many, many others, here are the most common types of counterproductive thinking categories for examples. Fortune telling occurs when you arbitrarily predict that things are going to turn out badly. I'll give you a couple of examples. My ex will do whatever it takes to ensure I self-destruct. A probability overestimation is similar to fortune telling. It's a type of assumption that is not based on facts because you're predicting that something is probably going to happen or come true today or sometime in the future. However, the chance of your prediction actually happening is not necessarily likely. Everybody in the courtroom will think I'm a jerk. I will lose my child for good if I make just one simple mistake. When I go to my son's school today to watch him play soccer, everybody's going to glare at me. An overgeneralization occurs when you view a negative event as a never-ending pattern of defeat. Things like this always happen to me. I will never, ever, ever be able to survive life without my children. Mind reading occurs when you arbitrarily assume that people are reacting negatively to you. The judge will think I'm a freak if he sees me blushing. My relatives must think I'm crazy because my kids don't want to see me anymore. All my friends always know when I'm feeling really anxious. Now, misattributions or single explanations are similar to mind reading. When you feel any type of negative emotion, such as hurt, fear, anxiety, or anger, it's easy to suppose that it was deliberately done on purpose and, of course, meant to upset you. Then you likely start jumping to conclusions and making assumptions about the other person's actual motives. I'm sure my ex is still pissed off with me for having an affair during our marriage, and that's why she's doing this to get back at me. He really did that to me to make me angry. A mental filter occurs when you dwell on the negatives and ignore the positives. I'm a really bad father. It's all my fault because I never spent enough time with my kids. Discounting the positives occur when you insist that your accomplishments or positive qualities don't count. Thanks for the compliments, but if you only knew what I'm really like, then you certainly wouldn't say all those nice things about my parenting. I am the worst parent in the world, and I deserve what's happened. Emotional reasoning occurs when you reason from how you think. I feel guilty, so I must be guilty. I'm such a loser. All or nothing thinking occurs when you look at things in absolute black and white categories, rather than recognizing that some things or situations can be pigeonholed. I am a bad parent. If I say just one thing wrong, I will blow my entire chance of ever seeing Jimmy again. If I don't look like I have it all together for this court trial, then my attorney's going to think I'm a real idiot. Global labeling occurs when you make negative judgments about yourself or others. Some common global labels include words like idiot, stupid, selfish, loser, jerk, F up, and so on. But rather than focus on a specific behavior, you incriminate the entire individual. Global labels are never true, given that they amplify a single characteristic and imply that that's the entire picture. So an alienating parent might say something like, your father is a complete screw-up and failure. All attorneys are uncaring jerks. All? Should statements occur when you criticize yourself or other people using words like should, shouldn't, must, mustn't, ought to, have to, ought not to? She should pay for this entire mess that we're all in. My friends should never think badly about my losses. Personalization occurs when you blame yourself for something that you weren't entirely responsible for. My kids wouldn't be alienated if I hadn't screwed up so badly in earlier years. The fact that my ex and kids left me is absolute proof that I'm incompetent. Blaming occurs when you blame other people and overlook ways that you may have contributed to a problem. My ex is entirely responsible for causing this high conflict court battle. Or I could enjoy life if it weren't for this alienation problem. Commanding or demanding occurs when you raise the level of expectations for yourself, others, and the world in general. Just wait until I talk to my son next. I'm going to tell him that he needs to love, approve, and respect me just the way he does his mother. Magnifying or catastrophizing occurs when you assume that if a negative event or situation was to actually occur, it would be absolutely awful, terrible, and insurmountable. You've probably heard the expression, making a mountain out of a molehill. In other words, you may be thinking that a situation is much, much worse than it really is. My life is a complete disaster. My pain is totally unbearable. Minimization occurs when you shrink the importance of what is actually happening or will happen in the future. Denial is also a form of minimization. There's no need to force my alienated child into having contact with me. I'll let it go. Life is too short. He'll grow up someday and see the light. Perfectionism occurs when you think that you, others, and the world should be perfect, flawless, and right. Individuals who hold these kinds of unrealistic standards for themselves, others, or the world tend to have overly rigid thinking and tend to experience tremendous amounts of unhappiness and stress. You know, my family was perfect until my marriage fell apart and this PAS thing happened. I know my life will be a breeze once we no longer experience family alienation and this whole thing gets fixed. Selective attention occurs when you generally pay more attention to certain types of information over other types. My ex has asked me to return our son home a day early on my weekend with him, even though she has offered an extra day at other times. Selective memory occurs when you generally remember certain types of information more so than others. The judge looked really bored when it was my attorney's turn to defend me. However, you ignored the judge when he appeared to be enlightened by some things that your attorney said. So perhaps you might be asking yourself right now, how do I stop this vicious negative think, feel, do cycle, as well as some of these counterproductive thinking categories or thoughts that I may engage in? Just before I do that, I'm going to quickly show you, I'm not going to go through everything outlined here on the list, but these are some of the most common types of negative thoughts that I tend to see when I'm working with alienated families, and these ones in particular, alienated parents. There's been many parents who have said to me when they're feeling so down and out and so helpless and so hopeless and so sad and just in such despair, maybe I really don't deserve my kids, or I don't deserve to get what I want. I did something wrong. I must have done something bad. I'm not good enough. I'll never be loved again. I deserve to be miserable. I do deserve to suffer. I've heard some people throughout the years even say to me, I deserve to die, or I'm going to die of a broken heart. I'm shameful. I'm a jerk, a loser. I can never be happy. I'm being controlled. I'm losing control. I'm out of control. I'm not in control, and I have to be in control. I'm trapped. I'm powerless. I'm vulnerable, helpless, weak, stupid, unimportant. I'm a disappointment. There's got to be something wrong with me. I have to be perfect. I have to act that way, and I have to please everyone. I've heard many people say to me, I am permanently damaged, or I'm a failure. I'll never be able to move on. I should have done something. It's my fault. I'm to blame. I don't feel safe. Typically speaking, I don't feel safe emotionally. I can't handle it. I can't stand it. I can't trust men, women, my estranged partner, ex-partner, my kids, my therapist, my attorney, my child custody evaluator, the court system, even my own judgment. So please keep in mind that it's the productive thought that counts. And what I'm going to do is I'm going to encourage you to think about what the benefits are of overcoming this vicious negative cycle when you're experiencing it, and counterproductive thinking by using various strategies that can outweigh the costs. I have to do this so briefly just because of what my time is, and this is something I would love to spend. I mean, typically speaking, I spend like a day or 2 days sometimes in workshops when I'm working specifically with alienated parents, so you're really getting a nutshell account here. But I'm going to just share with you some of the things that, the strategies that I provide parents to help deal with these counterproductive thoughts. The first question that you can ask yourself is, what counterproductive thought do I want to challenge right now? So let's pretend that you're thinking to yourself, I'm a bad parent. Okay, my question I'm going to ask you that I encourage you to ask yourself right away, is that true? Why not? Can you prove it? How do you know you're a bad parent? Why does it fit a particular category? Which category would that be? Any ideas right now? Go ahead. All or nothing thinking. It's black and white thinking. Ask yourself, why is it misguided for me to be thinking this way, that I'm a bad parent? Now, if you're having a hard time trying to talk yourself out of that and trying to refute this counterproductive thought that you have about yourself, then ask yourself this: how would I talk a good friend of mine out of such an idea if they were to say that to me? And they're an alienated parent. And I know what it was like before the alienation process started. I know they had a really good, loving relationship with their child. So how would I talk that person out of that? Now, some of these questions that I'm going to go through with you don't necessarily fit for whatever the counterproductive thought is. But other questions, this one clearly doesn't fit for, I am a bad parent. But you can ask yourself, what would happen if X occurs? And if that's true, what's the worst possible thing that can happen? And if that happens, why would that be so terrible? And what would that mean? And then what's the evidence that I have to prove that that is actually going to happen? You can also ask yourself, especially with moderate and severe cases that have been going on for years, ask yourself, can I still find happiness? What good things can happen if X occurs? What good things might happen if X does not occur? Can I be happy even if I don't get what I want? What might happen? How terrible would that be? Why would that devastate me? What is the probability of a bad consequence? What percentage of time has X actually been proven correct? What many alienated parents find as they get themselves used to thinking about refuting some of these counterproductive thoughts is that after they've asked themselves only maybe 3, 4 of these kinds of questions, and these are just some that I offer, I'm just giving you a real short idea here, that what happens is that they're able to talk themselves out of these counterproductive thoughts quite quickly. And once you do that, then you can come up with whatever your new alternative productive belief is. And then ask yourself, how does my new alternative belief make me feel in this moment? And how am I likely going to behave about this situation or circumstance given my new positive way of thinking and feeling? And what will the likely consequence or consequences be as a result? So, just as I'm about to end off here, I'm just giving you some examples here of productive thoughts that count. I deserve my kids. I deserve love. And no matter what happens, I'm going to be okay and I will survive. I know I'm a good parent. I'm going to make mistakes. We all make mistakes, as I often tell families or parents that I work with. You see that light bulb sitting at the end of my sofa? Well, it came with instructions. But when your child was born, there was no instruction manual. All of us, including those of us in the mental health profession who have had years of training and experience, when we have our own children, of course we make mistakes. There's no textbook out there that's ever described to me exactly what I've experienced as a parent. So we're going to make mistakes, and that's okay, no matter what happens. And it's also important as an alienated parent to always remind yourself, I did the best I could. I am a good person. I'm fine as I am. I can be proud of who I am. And I can respect myself for who I am. In true cases of PAS, you can clearly say to yourself, I am innocent. My life has worth and value. I have worth and value. I can trust my judgment. I can make good decisions for myself. I am strong. I am in control of my choices and my decisions. And I am in control of all of my responses. And I can respond to anything calmly. So those are just some ideas of how you can use productive thinking in everyday life. Thank you so much. It was a pleasure to be here.